Hello everyone and welcome. My name is Anusha Karki and I'm a primary health nurse. Today I will be discussing the main findings regarding the risk factors for non-communicable disease and the most successful strategy for health promotion that I will incorporate into my future practice, focusing especially on a priority population group, people with disability. We are focusing on main findings on risk factor for NCDs. Non-communicable disease are a group of chronic disease and their rising prevalence and incidence have made them an important priority for all health systems globally. The most common NCDs include heart-related cardiovascular disease, various cancers, chronic respiratory disorder, diabetes, and rheumatic and neurological disorders. And according to the data from the WHO Global Health Observatory, depression, diabetes or impaired glucose tolerance, high blood pressure, cholesterol, obesity, unhealthy diets are also common and preventable risk factors that support the majority of NCDs. For people with disability, these risk factors can be exacerbated by additional barriers such as limited access in healthcare, social isolation, and lower levels of physical activity. The main risk factor for these diseases are well documented. They are tobacco use. Tobacco use is a significant risk factor for CVD, accounting for 17% of death worldwide. And smoking causes various diseases, dyslipidemia, hypertension, arrhythmias, and valvular heart disease. Unhealthy diets. Unhealthy diet defined as those with poor fruits and vegetable consumption, excessive sugar, salt, and saturated and trans fatty acid intake have been linked to increased risks of cardiovascular disease, diabetes, and certain cancers. We also have harmful use of alcohol. Heavier brain drinkers are more likely to experience hypertension, arterial fibrillation, hemorrhagic stroke, CAD, and sudden cardiac death. Physical inactivity. A sedentary lifestyle is a key contributor to the development of cardiovascular disease, diabetes, and certain types of cancer. These are the risk factors for NCD with people with disabilities, and we are also talking about successful strategies for health promotions. As we can say that health promotion activities and resources should be accessible and inclusive, with healthcare facilities being physically accessible. Innovation like task sharing by eliminating the need to travel to healthcare settings, and mobile technologies may bridge gap in healthcare facility. Health literacy involves providing accessible information about NCDs, risk factors, and management techniques, while self management support emphasizes medication adherence and self monitoring skills. Collaborating with healthcare professionals, including psychotherapists, occupational therapists, dietitians, and social workers, to provide comprehensive care for people with disability, considering their physical and social aspects. We are also talking about heart healthy programs. It a comprehensive community-based initiatives aimed at promoting a healthy lifestyle and preventing cardiovascular disease through interventions related to food, physical activity, and smoking. The focus is on utilizing community resources for health promotion and disease prevention, fostering community participation, engagement for individuals to share experiences and strategy, and promoting physical activity, nutrition, and social interactions. I'm also talking about my new knowledge, like my study and experiences has given me a better knowledge of social determinants of health, such as accessibility, socioeconomic status, and discrimination have a sustainable impact on the risk factors and prevalence of non-communicable disease among people with disabilities. This information has brought attention to how crucial it is to be promote health comprehensively, addressing both wider systemic problems and individual behaviors. And I will incorporate new knowledge into nursing care, like build trust and open communication with my patient to better understand their unique challenges and motivations, work together with social workers in a community, physical therapist, and dietitian to offer all encompassing support and treatment for my patient. And for that, I will motivate my audience through providing health promotion message to individual needs, preference, and abilities, providing positive reinforcement, and providing rewards for the progress to encourage continued effort. Facilitate support programs, groups where people with disability can share experiences, motivate each other, and build a sense of community. And Lastly, in conclusion, understanding the main risk factor for NCD and implementing successful health promotion studies that are effective in reducing the burden of this disease and integrating new knowledge in my practice, I aim to provide holistic and effective care that empowers people with disability to lead to a healthier life. Thank you for your attention, and I look forward to working with you towards a healthier, inclusive community. Thank you.